So, dear friends, we are here in this conference all together, meditating, reflecting, studying what we're doing for health in the third millennium, right? That's the goal of the 8th British Congress on Medicine and Spirituality at a very critical time, at a time in which a pandemic is still rolling in the world. And it's not only about the virus or the death, the illnesses, the lingering diseases, but also the mental health issues that have been escalating, from suicide rates to all different sorts of mental illnesses that have been impacted by it. When we go to PubMed at the National Library of Medicine and we research, we see that only in the last year, between 2020 to 21, we have already had several articles pointing out the direction that mental illnesses have been, mental health in general has been challenged due to the pandemic. And why we're talking about the pandemic, since we're going to talk about the physiology of mediumship, because we want to contextualize per the theme of this meeting, health for the third millennium. Right now, what's happening, this pandemic is redefining the directions for many of us, either healthcare providers or scientists. It's redefining the whole field of work and what's going to happen next, inevitably. And it won't be different when we study about mediumship. If we talk about mediumship, just as a curiosity, this is not profound research, but just out of curiosity, if you go to the National Library of Medicine today and you insert the word mediumship, you see that just the word mediumship will bring 55 citations from 1973 to 2021. In 2020 alone, we had a spike, an increase. 18% of all time citations happened in 2020, which is quite interesting. We were talking to friends and discussing this, and they said, well, probably because people were home, they were finally able to submit the papers, finish their manuscripts, and reviewers had more time to review it. That's why they got published. I don't know the answer to it, but we had to investigate further. But a sure thing that the word mediumship is already navigating in the fields of sciences. The brilliant talk by Dr. Moreira just mentioned to us, there are groups of scientists who are more carefully dedicated to understanding the mind in its complexity, in its fullness, we would say. But it's not easy. In science, some questions that were raised here, it's not simple to go there and say, oh, let's research on this, because we're talking about funding. And funding depends on the push by society, and not necessarily this is in the main lines of our pipeline of concerns in our society. Not yet, though mental illness is a broad spectrum. Do we want to associate mediumship with mental illness? So let's check within these 55 citations from 1973 to 2021, the papers associate mediumship. They don't say that it is, but they are talking about mediumship regarding pathology of the mind, dissociation, consciousness, multiple personality, Psychiatric Disorders, Spirit Possession, Trance Processes, and even the relationship between mediumship and the brain. This is just a brief overview, because one thing we can tell, we are progressing. And more, and I'll go back to this graph to show to all of us that more and more we're seeing researchers dedicated and being funded to research on what concerns mediumship. We're going to talk about what we say mediumship is, but mediumship is already within the research of the medical field. Though still very confusing, it's not clear until we come to very lucid groups, like the groups coordinated in Brazil by Dr. Moreira, Luchetti, and others. Dr. Andrew Newberg in the United States, who had a collaboration with Dr. Pérez in Brazil as well, and they published papers. Dr. Gary Schwartz in the United States as well, as we are seeing the wonderful talk by Dr. Fenwick, giving us an overview about tangent topics as well. So we see groups in England, for example, talking about tangent features related to mediumship that will connect to spirit attachment, as they say, in the beautiful Spirit Release Foundation in England. So we see that as the days go by, more and more scientists, more and more healthcare providers are paying attention to the inevitable, something that William James, the bright and wise, William James at Harvard, dedicated himself to for quite a while when he researched, for example, the mediumship of a renowned medium at the time, Leonore Piper. And his conclusions are in papers in the scientific community talking about the inevitable conclusion that it exists, though we still lack in science, material science, we still lack a true consensus on terminology, which is still being worked out, and the full understanding of it, and even the acceptance. The acceptance, we're still far from it, but we know that there are people who are working on understanding what we call mediumship. So William James himself named in his studies that there is a supernormal knowledge. You and I need more. When I work with patients, students at the School of Emotion, in my practice, I see daily the need for more. Yes, we want to work with evidence-based approaches, but there are new paradigms as well. Probably science have not adopted, but we would say scientists like Dr. Moreira, Dr. Pérez, Dr. Newberg, Dr. Luchetti, Dr. Schwartz, doctors in this field of spirituality and medicine have been adopting, and we can certainly reach out to those who are suffering the most. This is a medical spiritist meeting. We cannot lose sight of the fact that suffering is existent. And the first thing we need to do is to reach out. How so? So let's go to some of the studies just to show to us briefly. I'm not going to discuss these studies here, but here's a reference for us. A very important study that happened in 2012 by Drs. Júlio Pérez, Moreira, Caixeta Leão, in collaboration with Dr. Newberg in the United States, when they had this deep and very thorough study on mediums who are named psychographers. We say automatic writing just out of commonality here in terms of words, vocabulary. And they observed many interesting things. But when they did the neuroimaging during the trance state, one of the things that is interesting to observe, though not conclusive, is that they compared inexperienced psychographers, people who would write, and others who were under the trance state, what we call the experienced mediums, that they actually brought from Brazil and were under the framework of the educational framework of Spiritism. They observed that those experienced psychographers, they presented lower levels of activity in certain areas of the brain. Well, areas like the culmen, the left hippocampus, the occipital gyrus, the anterior cingulate cortex, the temporal gyrus, the presental gyrus, compared to normal writing, non-trance writing imaging. Well, what does that mean? Well, many things, and it's not conclusive. We cannot tell nowadays that there is a pathway, because we neuroscientists always look at aiming at, is there a pathway, for example, in pain? There are pathways that modulate pain. We cannot say that there is a specific pathway, and we cannot conclude exactly the meaning of this lower activity in specific areas, but we can tell that, number one, which is very important, physiologically, it's changing the trance state of the mind during psychography is, let's say, producing changes in the activation of our brain, in our physiology. From a materialistic point of view, people could say, is the brain producing it? Are these areas producing it? Or from a non-extracorporeal perspective, a non-materialistic perspective, however we name it, is what the extracorporeal mind producing these effects in the brain, in the physiology? Science cannot answer this question. Can't. Science cannot say mediumship doesn't exist. Cannot say no to something that they haven't proved. But we know that in those trance states, these areas of the brain are differentially activated. We could go deeper into this study if we had time to go through the details of each area, but that's not the goal now. The goal is just to show that during that state, the physical body is in a different state as well. It seems second nature for us, but not quite, because it was the first time that it was presented scientifically. Another study that is quite interesting, and we have to recognize these Brazilian groups are ahead of the studies in spirituality, medicine, and specifically about mediumship. So Lucati's group here in this paper in 2018, just 3 years ago, shows to us a very interesting thing. They compared 20 female spiritist mediums with 20 female non-mediums, which were the control group. And besides many other things, they measured some physiological measures like hormonal levels, heart rate, vital signs in general. And they observed interesting things. For example, in the summary here, as you can see, just out of reference, because later, if you want, you can go there and read the full paper, but it shows to us that there were changes in these physiological measurements for the mediums compared to the baseline and compared to the control group. But interesting enough, they changed like an hour later after the trance state. This shows to us, besides many other things, of course, as they say, we need more studies to understand more, but it's so interesting to observe that what is happening to the mind is affecting the body. And as Dr. Moreira was presenting some papers to us, how it affects our mental health as well. So, psychiatrically speaking, we're seeing the beauty of these studies showing to us that there is not only the correlation between the mind and body, which we already understand, but we want to see that there is a special state of the mind that we need to consider, and it's not pathological per se. And when it becomes pathological, psychopathological, we need to take different measures, but there is a state of normalcy, we would say, when such state is entered, the mediumistic one. And that's why inevitably you and I need to ask help from the Spiritist science, because this is somewhat where the material science stops, does not answer much more to our questions, and has little, very little, still very little to help in regard to the spectrum of what to do when it turns to psychopathological issues, and we need to reach out to these people. So Allan Kardec, undoubtedly a researcher, a scientist, in 1857, changed the way we think. Little by little, the international community is getting to know of Allan Kardec. At Kardec Radio alone, we have, in the first 7 years actually, of our programs, we have interviewed hundreds of researchers, scientists around the world who are concerned about these issues. And we have all the interviews in our SoundCloud list for you, if you want to go back and revisit, from Dr. Andrew Newberg to Jim Tucker to Gary Schwartz, who was the first one, all of them recognizing, without a doubt, Kardec is a genius, still at the vanguard of humanity's progress, especially when we talk about the understanding of the human mind. From this perspective, Kardec shows to us that mediumship is a natural faculty. In the first chapters of the Medium book, he lays out clear-cut. It's not anything extraordinary. It's a natural faculty to us, so natural that it's physical, it's organic, it passes from generation to generation. Yes, it is physical. Why? We won't understand mediumship until we understand its multidimensional process, which is an expression that we found in some of the papers that were put together, published by Dr. Alexander Moreira's group in the past. Multidimensional process that will count inevitably on the understanding that we have a spiritual body. As you can see in this picture, which is a beautiful drawing from a scene that is described in the book In the Realms of Mediumship, or In the Domains of Mediumship, by André Luiz, through Chico Xavier, we're going to see this medium here dressed in blue, as her perispirit, we call it emancipates, expands, and allows the communication from the spirit. It's the speaking mediumship, and you can see this case, an obsessor, we call it an ill spirit, a mentally ill spirit, because we think mental illness is restricted to the brain. But in the Spiritist literature, we're going to find mental illness is something that happens in the spirit brain, in the brain of the spirit, because it comes from the mind, the mental body, affecting the whole physiology of this spiritual body, that will be temporarily connected, perispirit by perispirit, with the medium spirit to bring about the communication. We are talking about the perispirit as the venue through which mediumship is possible to happen. In the book, Mechanisms of Mediumship, or Mechanics of Mediumship, which was interestingly dictated, which is a phenomenon per se to be studied, 2 mediums, 1 spirit author, bringing, without a difference in style, chapter after chapter, a very comprehensive understanding of mediumship in ways that science would be puzzled to really see the depth of it all. Studied very deeply by scholars around the world, it tells us that on the behind the scenes of mediumship, there is the physiology of our thoughts. We need to understand how it happens. It all begins in the mind, and physiology of the thoughts here, André Luiz explains, it means the study of the interactions of these basic elements of thought with the surroundings. Meaning, thought is matter, electromagnetic matter, maybe not visible, tangible to the physical eyes, but it's possible to be absorbed mind to mind. We know the studies on telepathy, but we're talking about also mind to mind from an incarnate to discarnate point of view. And here we have Allan Kardec, also in the book Genesis, reminding us that we, as we think, we create forms, mental images that will be possibly seen by discarnates and connected, making connections. This mental matter, says Dr. André Luiz in the book Mechanisms of Mediumship, that it contains particles, mental corpuscles, and these formations based on different vibratory conditions than atoms in the body, they have positive and negative charges. So as we speak, as we think, we are forming, creating, co-creating images, living images, and this is a matter of health. Dr. Martin Seligman at Penn State University, the father of positive psychology, has been presenting to us compelling evidence that positive thinking, like Dr. Fenwick said this morning, there is compelling evidence that positive thinking leads to health. How much are we as mental health providers providing solid approaches to train or to counter condition the negative thinking into positive thinking when we want to help our patients? And if we go even further, prevention. We're talking about health. We're talking about health in the new millennium. We need to talk about prevention, not only remedying it. And prevention, when we talk about prevention, we're talking about the new generation, childhood. We're talking about schools providing new opportunities for students to prevent what inevitably may happen if we don't know how to think or how to feel. Thanks to the pandemic, several authors, from researchers to writing authors for children, have been providing new literature, and as Dr. Martin Seligman presents, new approaches to boosting in our children optimism as means to make resilient children, enduring the hardships of life, and preventing depression, anxiety, and other disorders. So now, as we talk about this mental matter, Dr. Andrea Luiz explains to us that this mental matter is so subtle that it's the instrument of our will. Will is so powerful, and we recall here the renowned Viktor Frankl, when he himself showed to us that when we give a new direction to our lives, we boost our will, we change the way we think, the way we feel, we change our lives. So when we think, we create mental waves. These mental waves will vitalize the centers of our soul. In non-Spiritist terms, people say the chakras. In Spiritism, we say vital centers. And it will vitalize us, giving us a tone of health or disease. And then we will produce mental interaction. Inevitably, we don't think alone. We're always connected. Just like our phones, if we put on the Wi-Fi, it's going to attempt to connect at all times. We have our human Wi-Fi on all the time because we have continuous thought and we don't stop thinking. When I ask somebody, what are you thinking? They say nothing. It's just because they are in lack of words, but we're constantly thinking something. We're constantly connected, producing mental waves that will allow mental interaction. And this is where illness or health may come true. As Andrea Luiz explains to us, when we read a page, consult a book, in a certain conversation, or when our focus is directed to something. Let's recall here, this is pre-social media, so we could say when we are reading something on the internet, listening to something, chatting with somebody, we are in correlation, spontaneous correlation with minds that are thinking alike, that harmonize with us, he says, through mental loads that we accumulated and transmitting form of pictures and serial sparks. And you may be asked, Vanessa, what does this have to do with mediumship, right? Well, first and foremost, Andrea Luiz proposes a model here for us. He says that there is a law of the mental field in which we are going to absorb what we're emitting. We're going to connect to minds that are alike. We're going to, at some point, either produce and enter constructive mental currents, which is ennobling and healthy, or the opposite, destructive ones, when the soul will externalize maladaptive and destructive mental waves, attracting equivalent content and often falling into obsessions, which leads us into mental illnesses. I like very much this word Andrea Luiz used in 1958, maladaptive, because a century before him, Darwin used this very word, adaptation, to tell us about our emotions, how we express it, and how emotions can dictate at some point directions to accommodate us into the important adaptation for survival. So André Luiz is presenting to us that as we think, as we feel, we connect. As we connect with other minds, incarnated, discarnated, we may present ourselves a new state of health or illness. Thus, he concludes in his paradigm, the Spiritist paradigm, that at the end of the day, if this is so, we're all mediums. Why? Because at every step, we're reflectors of the forces that we absorb under our will by focusing on our mental energy. So here comes to a point where we think there are mediums who are experienced in terms of their practice. But who is not a medium? If I get the book in this thesis that he presents to us in the book Mechanisms of Mediumship, André Luiz, in a chapter named Obsession, which is chapter 24, in the first paragraph, he teases us into new understanding. He says, the study of obsession, together with mediumship, will lead us in greater ways to understanding almost the whole humanity on earth. Showing to us that when we are studying the human mind, mediumship is just a natural faculty in us that we nowadays do not study at large, do not educate, don't even know what to do with it. Right now on earth, it's just a choice. In regarding our intellectual intelligence, we send children to school hoping that they will be instructed. Not necessarily boosts that much that intelligence, because we know that our intelligence is much more complex than we imagine. But we're talking about the concept of our spiritual intelligence, which is still in the realm of our will. If we want to, we pay attention. If we don't want to, we don't. But according to the studies of the Spiritist science and the inevitable studies that are coming along through our current science on Earth, the terrestrial science, we can conclude that we need greater attention to the study of this faculty in all of us. Number one, because it affects our physical body. In the studies of André Luiz, we're going to find areas in the brain that are specifically activated and through which these faculties being modulated. The pineal gland is one of the main areas that is already assigned or pointed out by the Spiritist science. Right now, we don't have a conclusive pathway for mediumship. Also because mediumship is broad, is vast. There are many different types of mediumship. There are many different levels of mediumship, let's say this way, in terms of education, in terms of experience as well. So it's going to be hard for us to really observe in the near future. If people ask, what do we envision? Some people ask me, what do you envision? In the near future, we need first to create a consensus on terminology, types, to really understand possible pathways. But we know that the physical body physiologically responds to this state of mind, the altered state of mind that will lead us to mediumistic experiences. So at this point, we would say our main concern regarding health for the third millennium is continuing support for the researchers and the scientists that can do this research and are allowed in their countries and are being funded to go ahead and do it. But also, we think that healthcare providers need to be, as Dr. Alexander was pointing out, encouraged to understanding the compelling evidence that we already have at some point in boosting new health in patients by encouraging them to follow their spirituality, their spiritual practice. And we say this, whether they say it's a religion or spiritual practice, but we would encourage Dr. Harry Canning at Duke University. Is one of the leading authorities in the field. He has spoken at previous meetings in the United States, and he shows to us that we will provide greater, not only assessment in terms of health, mental health, but also encourage greater recovery if we promote the spirituality that the patient has embraced. At this point, we want to highlight something that we have been observing through our practice at the School of Emotion with adults, teenagers, and children. And this is a paper that was published by Figueiredo's group in 2021, talking about mental health during the COVID pandemic, impacting especially children and teenagers, not only all of us adults, but impacting in terms of mental health. And they predict that if we do not take action right now, the long-term consequences possibly will be underdeveloped brain circuitry, obesity, substance abuse, lack of emotional processing, psychiatric disorders, suicidal thoughts. Some of it is already happening, but the pandemic's not over, and we still need measures to be taken to support the children, the teenagers, the healthcare providers, and the mental health workers into understanding how we can operate with this mind that needs to learn how to think, to connect well, and to be healthy. So we would conclude without actually concluding, because this is just a very brief, I recognize it's not comprehensive, it's just a brief teaser for us to show that we still need, besides the Spiritist movement that already educates mediumship, we need to understand the means and pathways to help people educate their thinking, their mediumistic abilities, which is connection, it's the human Wi-Fi, encourage spirituality because it certainly promotes health, and pathways through which we can help heal obsessions, which can derive from mental, mal-educated mediumship or non-educated mediumistic abilities, or not. So I'm going to stop here to possibly discuss with you, Natalie, and answer to some questions.
Okay. Thank you, Vanessa, for that most amazing talk covering those areas. I wondered if I can ask you, before the first question comes up, how would we create change in the teaching in the medical schools and the healthcare teaching establishments? How do we influence the deans of medical schools to accept this kind of thing? Because on the one hand, everything's in the scholars, but how does it get to the teaching profession?
Yeah. Natalie, I remember we were in a conference at the University of Maryland with researchers from Johns Hopkins in Baltimore, Maryland, and in the field of pain, just as out of an example, the field of pain, we were having this conference and we were discussing cases of patients in which chronic pain could no longer be treated in the traditional way. So we're discussing complementary medicine about it. And I remember one professor at Johns Hopkins, renowned professor, he looked at me and saying about acupuncture, he said, I'm not so sure if we have enough evidence that acupuncture works. So this is to show to us, Natalie, that the evidence is there, papers are there, but it depends on the openness of the faculty, the directors of programs who work on the curriculum to really step forward. But I see advancements that are clearly happening around the world. For example, here where I am at the University of Virginia, Jim Tucker and his group, they have, since Dr. Stevenson, lots of scientific research saying there is what they named a diathematic element, an element that goes from one life to another, crosses over death, that comes through. They can't explain the mechanisms yet, but they say we have evidence that reincarnation exists. But then when I asked some of them, so what do you do with it when your patient comes? They say, I don't know. So even the researchers themselves, they are blocked. And that's where I think we need, the first step would be discussions. Bring conferences into, bring complementary medicine discussions within the program first. As a director of behavioral sciences, I was allowed to insert in the curriculum not straightforward spirituality, as we were talking about here, but things that were coming along tangent, things that are already brought by Dr. Benson at Harvard University and the group in complementary medicine there. But we need first to raise awareness, to create awareness on this. And then at some point, people will come along and see that it's inevitable that we have to embrace the evidence and take measures from their own. Of course, if we talk about time frame, it's going to take decades ahead of us, to say the least, which is worrisome because mental health cannot wait. And the psychiatric hospitals in Brazil that have already absorbed the Spiritist approach, they have higher successful rates in treating patients with mental illnesses. Dr. Emma Bragdon here in the United States has been doing great works bringing physicians from around the world to visit the psychiatric hospitals in Brazil and even teaching them courses about it. So little by little, we're seeing people opening, but I say, Dr. Gary Schwartz once told me at Kardec Radio, he said, Vanessa, I can do this research because I'm already full professor and tenured, but you cannot because science is not going to allow it. And we still have a lot of impediments in terms of the heavy-duty research that in Brazil is already being allowed, thanks to the Spiritist movement and the openness. But around the world, we would say the strategy would be to bring conferences like this within the environment to raise awareness.
I think it's so important because there's such a disparity there's such an anger against psychiatry and psychologists. And we need to meet those people together. I mean, is there some way that Kardec Radio can have a role to play in that?
Yeah, thank you for the suggestion, Natalie. That's my homework. I'll, I'll, I'll think very carefully about it. I like your suggestion, yeah, on how we can do it through Kardec Radio as well. I agree. There is much work to be done. That's a sure thing, right?
Yes. No, that's right. I'm just wondering if there's questions that have come up through the chat that I haven't. Here we go. Here's one. Thank you, Arnoldo. What is the best science to study and be related to mediumship? Psychology, medicine, parapsychology, or do we need an interdisciplinary way to understand it better? This is your last question before the
All
break.
right. Thank you, Natalie. Thank you, Arnold, for this question. You know, when I think through this question, I would say, I can't sugarcoat it. I'm going to say, the Spiritist science is the best you have now. Why? Because it's very comprehensive. We have very thorough understanding. Just the book Mechanics or Mechanisms of Mediumship by Andrea Lewis is a thesis on it, so deep, so compelling in the realms of mediumship that we have enough just there to understand, study mediumship. I don't think medicine, psychology are there yet. They have things here and there, but nothing really solid.
No, I'm aware of that. Well, let's see what we can do. Thank you very much again.
Thank you.
For speaking. And there seems to be a question at the bottom. Dear Vanessa, how do you believe this awareness regarding mental health and spirituality can be brought to young adults themselves who rebel against notions of spirituality?
I will share something that I do in my practice. When I see, for example, a preteen coming, the father, the mother says, "Oh, Vanessa, he or she is experiencing some rebelliousness, etc. The grades are dropping. They're not able to sleep well." And then when we do an assessment, we observe, because I'm a medium too. I have to say, I'm a medium too. Maybe scientist, psychologist, but I'm a medium. I can see the spirits. I can talk to the spirits too. So it's clear when I'm talking, I can see. What do? I don't tell the kid, of course not, because that's going to scare them away. But I can ask them. I like Socrates' method of questions. Ask them. Bring them little by little to surrender to the inevitable and logical way. We are not self-made. The force that created us, whether we need God, Allah, Jehovah, however it is, why are we here? So we little by little can ask them questions per the allowance of the parents, per the spiritual path. So at the School of Emotion, we ask people about their spiritual path, their religious embracing, and we encourage them to think about it as we go along, because our belief is going to dictate our decisions, and our decisions will create lots of emotions. So we can't treat our emotions without going to the root cause of it all. So I would say we need a patient approach, but it's possible.
Thank you. And there is one more question. This is the last one. This is the really last one.
Sure.
Vanessa, do you think that one of the difficulties to accept spirituality is because we're looking for a human God?
Stephen, thank you for this question. It's going to be my homework too. I'll think about it. I don't know the answer to that. It could be. But I would say one thing that I've been thinking about. I think it's because people have they are lazy to think. We have a disease that is happening nowadays in our society. Everything is just a click away. So some people, they have a hard time thinking. I remember a colleague of mine, very bright. We were looking at the microscope. He turned to me and asked, Vanessa, why do you believe these things? I never told him, but people talk. And I never explained anything because it's none of my business. So I said, let me ask you a question. That's how I answered to him. Why do you work so hard? Why are you so bright in what you do if you think life's going to end? It doesn't make any sense to me. So that's the answer. We need to be willing to think, to reason. And that's why I think Kardec was the brightest of them all, because he was not afraid to bring together faith and reason, without which we cannot solve the problems of the human mind.
Yeah. Thank you. And while we've been talking in the chat, Edwin Bravo has said in Guatemala, in the Master of Geriatrics and Gerontology, he teaches the bio, psychosocial and spiritual aspects. So things are moving.
Yes.
Things are moving. All right. Thank you, Edwin. Now we're going to take a 5-minute break, 6-minute break, and hopefully we'll have some music, and then we'll have another speaker. I wonder who that could be. All right. Thank you.
Thank you.